Hi, welcome to the Fit and Healthy Today show. And today our topic at hand is Seasonal Affective Disorder, also known as SAD, hence the symptoms that occur. It's characterized by symptoms of depression when we start to lose sunlight. And it tends to be more common among people who have olive or darker skin, because genetically, as a general rule, we require a little bit more sun, and when we don't get the sun, in particularly the areas where we live in the United States, we don't feel as good. So it does require a full spectrum lighting. So sitting under standard fluorescent bulbs or standard light bulbs, especially those new brand new ones that are produce not a full spectrum lighting, will end up very depressed. So the symptoms that we get with this seasonal affective disorder, also known as SAD, is we'll get fatigued, lethargic, and everybody around the winter months is going to feel probably a little bit more saddened, not as happy, just not as energetic. The sun for all of us tends to make us feel better, and if you notice on rainy days, we've been intermittently getting rainy or kind of cloudy days, nobody feels 100%, or they feel a lot less energetic than they would normally on a sunny, warm day. You don't sleep as well. You don't have as good of ability to concentrate. You get a lot of cravings for sweets and carbohydrates, because those carbohydrates will tend to raise the serotonin levels, because you're trying to make yourself feel better, and those sweets, hopefully, you're hoping, will make you feel better, but in the long run, and I'll explain this, they won't make you feel better. And then oftentimes we get weight gain, and believe it or not, a loss in sex drive. So, you notice in the spring everybody starts to perk up and everything, we're getting more sun, and literally people will have, as a general rule, a greater sex drive as a result of sunlight. But particularly with people with SAD disorder, if they don't treat it in what we talk about, their sex drive, weight gain, wanting to eat more, feeling down, lethargic, wanting to sleep more but not sleeping well, all will arise. Now, the ultimate cure is obviously natural sunlight. But the problem is, when we lose this natural sunlight, especially when they change our time on us, and it's dark here in Lompoc at 4:45 in the afternoon, it decreases our melatonin production, which, and you think in terms of serotonin when you lose light, which makes you feel good, but it also decreases melatonin. So oftentimes, you will not sleep as sound. So when you don't get sunlight, melatonin production drops as well. And that's the hormone the body produces about a half hour or so after the sun goes down, or if we have our biorhythm clocks, like mine, usually about 10:30, 11 o'clock, I can feel my melatonin kicking in, and I get a little bit sleepy and I want to go to bed. Also, too, when you don't have natural sunlight, your stress hormones tend to rise. The cortisol rises, and as you're fighting this tiredness or whatever, you're probably doing caffeine or whatever, sugars or whatever, to make you feel better, and what results is your blood sugars get out of whack. The caffeine makes you hyper. You're not feeling any better because you're losing or don't have as high a production of these certain hormones. So when we're talking about treatment as far as things that can be helpful, they have the full spectrum bulbs, excuse me, that you can buy, or full spectrum lamps with the full spectrum light bulbs that you can buy. And they say basically you need about 1 hour a day. And I know that sounds like a lot, but if you're reading at bed at night, or if you can have that full spectrum lighting with you at work, I know we have full spectrum light bulbs in our health food stores. And so it helps us and it helps our employees prevent some of this SAD that occurs. Try to spend as much time outdoors. I spent outdoors because I knew I really needed it this weekend, out in the sun mowing my lawns and doing some yard work, even though I probably would have rather been doing other things. I was out in the sun trying and recognizing that if I didn't get the sun, I wouldn't feel as good the rest of the week. And it does tremendously make a big difference on my mood. I know, see, I'm olive skinned, and I know full well if I don't address these issues, this will take place with me. So full spectrum lighting, trying to spend some time outdoors. If you've got an office where you can be near a window that gets some sun, that's helpful as well. It is filtered sunlight, so it's not quite as good. And something that I didn't write on here, everybody goes around with their sunglasses on. And I know it's like there's bright light and all, and I can understand that for driving. But seriously, whenever you can and you're out in the sunlight, try not to wear your sunglasses, because it's really important. When the sunlight hits our eyes, it stimulates pituitary, which is our master gland, and it will increase and help with our serotonin production and other hormonal productions as well. Very, very important. So don't go around wearing those sunglasses all day long. Do the best you can to try and go without them to some degree, at least while you're not driving. Now, we briefly touched upon the diet, but this is very, very important. If you suffer from this, or if you notice minorly or majorly, you need to really, really pay attention here. You've got to keep the blood sugars stable by eating every 3 or 4 hours. And that means eating meals that have a balance of proteins, fats, and carbohydrates. Not just sitting there grabbing the bagel or the donut or you know, a bowl of cereal at night before you go to bed because it makes you feel better. That's a naughty no-no, because it's going to mess with blood sugars and it's going to make you feel worse. We've got to have that balance. And if you go on youtube.com/VHFILM, we've addressed something called the metabolic diet. And you can look it up on that YouTube website and watch the show on the metabolic diet, which would be a very helpful diet to prevent seasonal affective disorder. Eating a minimum of 20 to 30 grams of protein at least 3 times a day. Protein wakes up the brain. It makes you feel better. And I hear more people that tell me they go out the door with a bowl of cereal, and then at lunch they grab a quick burrito. We got 10 grams of protein going in their bodies at that time. By then they should have had at least 40 to 60. So protein wakes up the brain. Once again, it also keeps the blood sugars stable. So proteins, fats, and a mixture of carbohydrates at each meal is very important for SAD victims. Avoid the sugar, the white flour, the alcohol, pasta. You know, try to stick with your lean proteins, lots of your vegetables, you know, foods that are actually really good and nourishing for the body at this time. Now, there are certain food additives, sodium nitrates, red dye number 40, most of the dyes and chemicals that you're going to find in your vitamins and supplements that you're going to get like from the major warehouse companies, or in your foods, in your hot dogs, just about in everything that you're going to shop that isn't coming from the perimeter of the grocery store. And remember too, pesticides and herbicides also affect the mood. So if you're not shopping organic, guess what? You're going to affect how good you feel as well when it comes to your serotonin and cortisol production. So keeping the food balanced, caffeines to a minimum. I understand that little cup of coffee or tea in the morning. You know, I do it myself. Give me a nice little start. But I make sure I have the proteins, carbs, and fats first thing in the morning. And I'm not doing caffeine on an empty stomach and darting out the door, trying to wake my body up with no fuel. Now, when we talk about the supplements, and there's quite a few on here, and it's kind of interesting because each of them do a little something different, and it depends on the particular individual on how well a lot of these will work or what symptoms that you're exhibiting. But the majority of these all have, well, actually everything on here all has clinical double-blind placebo studies, and the majority most people can take, except for some of the ones I've written exceptions for when people are on antidepressants or anti-anxiety medications. Number 1, a good multiple vitamin high in Bs is paramount to raise mood. Those Bs help you deal with stress. They elevate the mood. They make you feel better. And once again, I'm not talking about the warehouse or the local grocery store. We need a good vitamin that has chelated minerals, natural vitamin E, natural beta-carotenes. We need a good multivitamin. Despite what Dr. Oz says, referring people over to one of our local warehouse stores to get their multi, most of those, when you look at independent guides and studies, have a 4 to 10% absorption. I could mention several of the major brands, but I'm not supposed to, so I won't, that literally the majority of the population takes with absolutely no effect. So you need a good vitamin from a good local health food store, and you can ask them. Hopefully they'll have an idea of what the rankings are. There's a wonderful comparative guide out there that tells us how absorbable a lot of these multivitamins are. Fish oil. Fish oil, and we want at least 500 milligrams of DHA twice a day. Now, this helps with depression, with mood. It calms the mind. In our bipolar show that we discussed, this issue that actually calmed and stabilized mood in people who had extreme mood elevation and delation. So that can also help with depression. There's a very good product that's extremely safe called SAMe that actually is very good for the liver and for the joints. And what it does, it increases the concentration or the body's ability to use serotonin and other neurotransmitters for balance. It should always be taken on an empty stomach, but very safe and very effective. As a general rule, you can take SAMe with antidepressants and anti-anxiety medications, but it does give a warning on the box, and so you probably want to speak to your local healthcare professional. We have a couple of doctors that do utilize those at the same time, because SAMe helps you use the actual serotonin, whereas the reuptake inhibitors just form a dam block, and it doesn't help you utilize the serotonin any better, whereas SAMe does. Now, 5-HTP is a precursor to serotonin, and L-tryptophan has similar effects, both taken on an empty stomach. Now, those you cannot take at the same time as serotonin reuptake inhibitors, Prozac, those types of drugs, because it actually does raise serotonin. Now, it doesn't form a dam block like a uptake inhibitor. It actually increases the synthesis of serotonin. And we have a couple local doctors that recommend this for depression, but it is found to be very effective for SAD. Now, St. John's wort, which has been around, along centuries, and it's gotten a bad rap off and on, but in true government studies, not pharmaceutical studies, which I would never trust because they always have an agenda, it basically showed that this really was helpful, 300 milligrams with a 0.3 hypersen level 3 times per day was very helpful in a double-blind placebo study with light therapy at raising that sadness that people and depression that people experience with the disorder. Now, DLPA, D-L-phenylalanine, is an amino acid, but it works a little bit different. It raises what is called endorphins. And endorphins are the things that we get when we exercise, when we move, when we're happy, when we do things that we enjoy. And so the DLPA raises those endorphins and can be a mood elevator for you. You can take that at the same time as SAMe or 5-HTP, but it is not recommended, again, with antidepressants or anti-anxiety medications. Vitamin D. Man, I think the government said over 90% of Americans are vitamin D deficient. And that's for our bones, for our lungs, and for our mental health. So it would be an excellent idea to have a vitamin D test on your yearly checkup and to find out whether you're vitamin D deficient. But most of the physicians and the studies are backing between 2,000 and 5,000 IUs per day. It really does elevate mood. Because remember, when you're out in the sun and it's hitting you in the summer months, you're producing vitamin D. And that's the one thing, when we lose the sun, we lose our body's ability to uptake and make vitamin D in our skin because we don't have either the sun or we're covered up because we're cold. Melatonin. Now, I know a lot of people don't associate this particular hormone with this seasonal disorder, but melatonin, 1 to 3 milligrams, preferably the sublingual under the tongue, really can be helpful to help you sleep if you notice that you have an issue during these winter and early spring months. And I would start with the lowest dosage if you have a hard time sleeping, and 1 milligram. And if you're taking too much melatonin, you'll wake up kind of drowsy. It is safe to take with other sleep medications because it is a natural hormone that the body produces. And it's one of the most anti cancer hormones that the body can have. When your melatonin production is low, your risk of cancer rises substantially. L-tryptophan for sleeping as well, but can also help with serotonin, but once again cannot be taken with antidepressants or anti-anxiety medications. Green drinks, chlorella, spirulina, all of those types of superfood greens, and then your vegetables where you've got all your kale and your broccoli and your spinach. Those greens oxygenate the blood and they give you energy. In the 5 protein shakes that I drink throughout the day, because I'm a natural bodybuilder, every one of them I try to get chlorella or spirulina in there, because it oxygenates, detoxifies, and just makes me feel better. It gives me more energy. Phosphatidylserine. Now, this is a key fatty acids, and I find this particularly helpful with seniors. I had 2 seniors come in today that we had talked about phosphatidylserine to help decrease some of the stress they were feeling on their brain, as well as improve their memory. Because when you're sad or you have issues with this seasonal affective disorder, it can affect your memory. And phosphatidylserine fatty acid, 100 milligrams 2 to 3 times a day, you'll notice the effect on your clarity of mind and memory. You'll notice it within 2 weeks. Very, very, very fast. It's a key fatty acid in the brain that we oftentimes are missing. And so that can be very helpful as you notice when the summer months go away. You're just not thinking quite as clear. There are some homeopathic remedies that can help with depression. They're very, very specific, and if you come into the store, I can show you the book and you can kind of pick out ones that might be appropriate for you. Anyway, I hope that's helpful. Next, we're going to be moving on to the fitness portion of our show. Thank you. Hi, welcome to the fitness portion of our show, and today we're going to be talking a little bit about posture. Now, in modern day society, with everybody working on their computers all the time and everything, we're going to tend to get this slumped over mode, where people are going like this, and their posture isn't upright. So, the problem lies with that is we end up with a shoulder that's going to be very, very imbalanced. Let me just give you a demonstration. I'm hunched over. I can't even raise my hands above my head in an hunched over position. And if I'm hunched over all the time, never reaching above, good luck. But when I straighten my posture, I can reach overhead very easily. So it's very important to keep the posture. Now mind you, when we're doing posture, we don't want to go like this, but we do want to stand erect, keeping our spine straight, try to tuck in the tushy and hold the gut in a little bit. That way too, our muscles will be balanced when we go to reach for things. Because if we go to reach for things like this in a standard way, because our muscles have become constrained like this, because this is how we've held the position at our desk at the computer for so long, we're going to become very imbalanced and we're going to end up with more shoulder and rotator injuries. So do your best to have a chair or make a conscious effort to try and be upright and not slouch so much. Next, we're going to be moving on to the science research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph.
And thank you for that intro. Now, to lead off with our first trivia question. All right, teachers and children mistake candy for medicine in a study. What percentage of kindergartners and what percentage of teachers could not tell the difference between candy and medicine in a study which was published in the October 17th American Academy of Pediatrics? Towards the end, we'll come back to that. Now, first things first, breast cancer and an ingredient in red wine. Once again, for resveratrol. Again, the drum of resveratrol has been beating for quite some time now. It's become more and more popular, and don't be surprised soon of other television media moguls began paying attention to it. Why is it important? Well, in the October 2011 issue of the FASEB Journal, they showed, and I'll quote unquote, that resveratrol, the healthy ingredient in red wine, stopped breast cancer cells from growing by blocking the growth effects of estrogen. Now keep in mind, they said stop breast cancer cells, period. They suggest for the first time that resveratrol is able to counteract the malignant progression, which inhibits the proliferation of the hormone-resistant breast cancer cells. They said also, resveratrol, the ingredient in red wine, is a potential pharmacological tool to be exploited when breast cancer becomes resistant to hormonal therapy. Again, as a powerful tool to some very expensive treatments when they fail. They found an important reduction in the cell growth in cells treated by resveratrol, while no changes were found in untreated cells. Additional experiments revealed that this effect was related to the drastic reduction of estrogen receptor levels caused by the resveratrol itself. Something to take into mind and research on your own. If breast cancer is concerned in the family, then basically it may not be a bad addition to somewhere in your diet as a supplement, food source, or wherever. I don't know how much red wine you got to drink to get the therapeutic effect of resveratrol, but still, it's something that deserves looking into. All right, now we go to infants. All right, now one thing that's really interesting is something called AGE, which is called an advanced glycation end product, which ironically also, by the way, ages you. It's something which is often found as a byproduct of toxic glucose byproduct of high blood sugars. Well, they decided to look at infants actually after the first year of being weaned off of breast milk. And this is what they discovered. This is out of the Diabetes Care, December 2010. Showed that AGA levels were elevated in the infants. Now, what they discovered was this, and quote unquote, they found that newborn infants expected to be practically advanced glycation end product free had levels of these AGEs, advanced glycation end products, in their blood as high as their adult mothers. The reason this is important, they found out that when you process baby formula under high temperatures, which most commercial baby formula is, it makes a tremendous number of these advanced glycation end products, in which they said that is basically delivers a huge amount to these infants, which can be toxic. Also, the reason for this is because the AGE causes the diabetes, inflammation, and a ton of other byproducts in the body, or symptoms, I should say. Quoting them, the work led to the second report on the Diabetics Care in July 2011, which demonstrated the modest cut in food high in AGEs, which are heat-treated foods, pasteurized, baked, fried, all your fun type of commercial stuff. Improved insulin resistance in adults with diabetes. AGAs are found to be elevated in mostly grilled, fried, or baked foods. Cutting back on the consumption of the foods that are heat processed, not the carbohydrates, not the fats. We're not talking about the makeup of the foods, just food that is treated with high heat. Improve the insulin levels and overall health in patients already treated for but remaining insulin resistance. They found that the findings are a dramatic departure from the standard clinical recommendations of the management of regular diabetes. They said an AGE, or advanced glycation end product restricted diet, emphasizes poached or stewed foods such as mashed potatoes over French fries and boiled eggs over fried eggs. In fact, just removing the AGE foods from an adult's diet improved insulin levels by 35%, which beat most therapeutic drug treatments right off the bat. But the disturbing part again is this. We're starting them off with our infants. We're beginning to make these kids diabetic regardless of their calories or sugars or what they're consuming. It's highly processed, heat-treated foods. The industry knows about it. Well, at least now they know about it. Let's see how long it takes for them to start being concerned about your child. All right, now we go to, again, infants once again. And this is what you should call the medicine of conformity. When doctors just get in the habit of doing something without knowing the reasons why they're doing it. This was in the Journal of Pediatrics. And this was in the commentary. They found out that they were beginning to prescribe acid-suppressing drugs to children under the age of 12 months, even though the FDA did approve them for children over the age of 1. And they said this has been going on now for the past decade. It's what we call off-label drug use. It says, however, and this is a quote from Dr. Hassel, who did the commentary, in the absence of better information and physician guidance, and fed by advertising and misinformation on the internet, distressed parents take their concerns to doctors who frequently comply and prescribe acid-suppressing medications for symptoms and signs that in most cases are not GERD-related. Yes, doctors and medical professionals, too, can also be misled by propaganda on the internet. Studies have shown that these protein pump inhibitors, which are antacids, are no better than a placebo for infants, number 1, which have spitting up, irritability, and unexplained crying. No better than a placebo, but far more, I should say, harmful. Irritability or unexplained crying with or without spitting up is often a normal developmental phenomenon, especially in infants 2 to 5 months old. Although some infants are unable to self-calm, this also proves with maturation and age. And Dr. Hassel brings up a really good quote. He goes, we are medicalizing normality. We are medicalizing normality. Things which normally happen when kids are growing up, we are basically beginning to treat as a disease. In most infants, these symptoms are life, not a disease, and do not warrant treatment with drugs, which can have significant adverse effects. He explains that the gastric acid is an early line of defense against infection and is important for nutrition. By prescribing acid-suppressing medication to infants without GERD, pediatricians are putting their patients at a higher risk for infections like pneumonia and gastroenteritis. The use of protein pump inhibitors in infants could also lead to abnormalities in the levels of essential minerals and vitamins such as magnesium, calcium, and vitamin B12. All right, now what I am going to do is I want to come back to an article next week, which I'm going to leave off, which is real important to deal with the amount of radiation or radiation byproducts which are in cigarettes, which should not make the news, which should be in the news, bottom line. But I have less than a minute remaining, so let me go back and end the trivia question. What percentage of teachers did not know the difference between candy and medicine and kindergartners? Well, 1 in 5 kindergartners could not tell the difference between medicine and candy. 1 in 4 teachers cannot tell the difference between medicine and candy. All right, let's keep that in mind. All right, this is the end of it, and that was published in the American Academy of Pediatrics. Thank you very much. Thank you.
Thank you very much, Ralph. Good information. Once again, research for yourself. Thank you very much for joining our show.